If you've ever stared at your Social Security deposit like it betrayed you, you know this feeling. It's early January. Your bank app loads, the number pops up, and your brain goes, wait, why is it smaller? Not smaller than last month, smaller than what you thought you were getting, because you heard COLA, you heard raise, and then the deposit lands, and it feels like someone took a bite out of it on the way to your account. Here's the uncomfortable truth. They did. Not a hacker, not your bank, not some mysterious glitch. It's Medicare Part B, and it collects before your money even becomes yours. Most people know the deduction exists. Almost nobody knows what it actually is, why it changes, or where it goes. So today we're going to follow that missing money like a receipt trail, because once you see the pipeline, the deduction stops feeling random and starts feeling inevitable. And this matters right now for one simple reason. Late December and early January are when the new numbers show up. In mail, in your online account, in your deposit. This is when people compare checks, panic, and then run straight into the loudest rumor online. They cut my benefits. Usually, they didn't. Usually, your check is doing what it always does. It delivered your benefit and paid Medicare first. Let's strip it down. Medicare isn't one program, it's parts. Part A is the hospital side, inpatient stays. Most people don't pay a monthly premium for Part A because they prepaid it through payroll taxes while working. Part B is the everyday medical world. Doctor visits, outpatient care, tests, imaging, preventive services, durable medical equipment. The stuff you don't think about until you're suddenly scheduling 3 appointments in 1 week. Here's the simplest way to picture Part B. It's the outside the hospital bucket. You walk into a doctor's office, Part B, you get lab work, Part B, x-rays, MRIs, outpatient surgery, physical therapy, a walker, oxygen equipment, mental health outpatient visits, preventive screenings, and vaccines. That's the Part B world. And when you use it, the money doesn't teleport from your premium to your doctor in real time. It runs through Medicare's claims system. A provider sends a claim. Medicare decides what's covered and what the allowed amount is. After you meet the annual deductible, Medicare generally pays its share, and you're responsible for the rest, often as a percentage. So the where the money goes answer is two-part. It pays for the benefits you use, and it pays for the system that decides, processes, and pays those benefits. Part B is optional on paper. In real life, it's the coverage that keeps your health plan from having huge holes. So most people take it, and once you take it, Part B charges a monthly premium. If you're receiving Social Security, Medicare usually doesn't mail you a monthly bill. It simply withholds the Part B premium from your Social Security payment automatically. That's the first mental shift. Social Security is the delivery truck. Medicare is the toll booth. So where does the toll money go? Your Part B premium goes into the Medicare Supplementary Medical Insurance Trust Fund, the SMI Trust Fund. That fund pays for Part B benefits. It also helps pay for Medicare's administration, the machinery that processes claims and fights fraud. So you're not paying your personal doctor directly. You're paying into a pool that reimburses doctors and outpatient providers after you get care. You're buying access to a payment system. Now the uncomfortable math. Most people assume the monthly premium is the cost of Part B. It's not. For most beneficiaries, the standard Part B premium is designed to cover about 25% of the expected cost. The other, roughly 75%, comes from federal general revenues, taxpayer money authorized by Congress. So your premium is not the whole price. It's your share. That's why it can rise even if you didn't change anything. For 2026, the standard Medicare Part B premium is $290 per month, and the annual Part B deductible is $283. That means you pay the first $283 of covered outpatient costs for the year before Part B starts paying its usual share. And even after that, many services still come with coinsurance. So Part B is a monthly subscription, plus an entry fee, plus ongoing cost sharing. And because it's deducted automatically, you can go months without feeling the cost until you try to budget and realize the missing money is permanent. Now here's where the story gets spicy because Part B doesn't have one price. There's the standard premium, and then there's the income-related premium. If your income from 2 years ago was above certain thresholds, Medicare adds a surcharge called IRMAA, the income-related monthly adjustment amount. Same Part B benefits, higher monthly price. This is why someone can retire this year and still get charged like they were working. The system is looking in the rearview mirror. If your deduction jumped by more than the standard increase, IRMAA is often the reason. And yes, if your income dropped because of a major life event, there are appeal options. But first, you have to recognize what you're seeing. Now let's talk about the moment people get mad, the raise that doesn't feel like a raise. Social Security gets a COLA. For 2026, that COLA is 2.8%. Medicare Part B premiums also change year to year. So the government announces a raise, and many people experience it as "I got more." Then it vanished. Here's a simple example. Say your Social Security benefit is $2,000 a month. A 2.8% COLA adds about $56, bringing you to $2,056. But if your Part B premium went from $185 to $202.90, that's a $17.90 increase. So your gross benefit went up $56, and your Medicare deduction went up $17.90, and your raise feels like about $38.10 before you even talk about taxes, Part D, or anything else. That's the bite mark. Now there's a hidden rule that sometimes changes how sharp that bite is. It's called the hold harmless provision. Its job is simple. For many people who have Part B premiums withheld from their Social Security checks, it prevents the Part B premium increase from being so large that it reduces your net Social Security payment compared to last year. In plain English, it tries to stop your check from going backwards just because the premium went up. But notice what it doesn't do. It doesn't promise you'll feel a raise. It just tries to prevent an outright cut. And it doesn't protect everyone the same way. If you pay Medicare directly because you're not collecting Social Security yet, or you're subject to income-related surcharges, you can experience the full increase without that buffer. And this is why two neighbors can open the same kind of letter and argue like it's a conspiracy. Neighbor A says they took $202.90. Neighbor B says, no, they didn't, they took less. Both can be telling the truth. They're just standing in different parts of the system. Now let's clear up one of the most common misunderstandings. Medicare Advantage does not replace Part B. It wraps around it. If you join a Medicare Advantage plan, you still have to pay the Part B premium. Some Advantage plans have a separate plan premium too, and some are $0. A few even help pay part of your Part B premium. But the baseline reality stays the same. Part B is the ticket that gets you in the building, which means someone can look at their check and see multiple deductions. Part B, maybe a drug plan premium, maybe an Advantage plan premium, maybe an IRMAA surcharge. And to your bank app, it all looks like one thing, less money. And sometimes the story is even weirder. You might have Part B, but you don't see a Part B deduction at all. If you qualify for Medicaid or a Medicare savings program, your state may pay the Part B premium for you. And if you haven't started Social Security yet, Medicare can bill you directly instead of withholding it. Same program, same premium rules. Totally different way it shows up in your life. Now let's do the contrast the internet never does. The hype version says, Medicare is stealing your Social Security. The reality is colder, and that's why it sticks. Part B is expensive, partially subsidized, and built to adjust with costs. Your premium is the plug that keeps the system funded month after month. And the deduction method, taking it straight from your benefit, is not an accident. It's the most reliable way to collect. No missed payments, no chasing people for checks, no drama, just subtraction. There's one more piece that explains why this deduction can follow you for life. Timing. If you delay Part B enrollment without qualifying coverage, there can be a late enrollment penalty. Typically, it's 10% for each full 12-month period you could have enrolled but didn't. And it can last as long as you have Part B. So the system doesn't just charge you, it remembers. Now zoom out. Your Part B premium is not just about you. It's tied to a national funding design. Because Part B is funded by premiums plus general revenues, it's structured to keep paying claims as costs change. When costs rise, the program adjusts. Premiums rise, general revenue contributions rise, which means the system can keep running. But your household budget feels the adjustment first, as a deduction. And that's why this topic keeps getting louder every year. Not because Part B suddenly appeared, because more of your raise has to compete with it. So the question isn't only why did my check change? The better question is, if healthcare keeps moving into the outpatient lane and the price tag keeps climbing, how much of your retirement check is going to remain a payment you control, and how much of it is going to become a pass-through bill you never actually get to hold? Factual anchors used, so the numbers are grounded: CMS 2026 Part B Premium and Deductible, CMS, SSA 2026 COLA, Social Security, SSA CRS on Part B financing, roughly 25% premiums, 75% general revenues, Social Security, Medicare.gov on automatic withholding and what Part B covers, Medicare, Medicare.gov on Medicare Advantage still requiring Part B premium, Medicare, Medicare.gov late enrollment penalty basics, Medicare. 8th monthly check. Proof letters and tax forms, especially during the season when you actually need them. Benefit verification letters are often used for housing, loans, assistance programs, or anything that wants proof of income. Tax forms like the SSA 1099 matter for filing. You don't have to download these every month, but you do want to know where they live and how fast you can access them, because the worst time to learn your login is broken is the day before a deadline. 9th monthly check, your sign-in security itself. This is the least glamorous check and probably the most important, because my Social Security access runs through stronger sign-in systems now, like login.gov or id.me. That's good security. But it also means if your login method breaks, new phone, lost number, changed email, you can lock yourself out at exactly the wrong time. So once a month, you make sure you still control the email tied to the account, you still control the phone or authentication method. You have backup options set up. This isn't paranoia. This is what adults do with accounts that control money. Now here's the part that's going to sound slightly ridiculous until you think about it. Your Social Security account is one of the few accounts in your life where a single mistake can cost you twice, once in money and once in time. Because if you lose access, you don't just reset a password and move on. You enter the world of identity verification, waiting, appointments, forms, and please hold. And that world does not move at the speed of your rent. So the monthly check isn't a task, it's a time-buying strategy. And now we need to confront the hype versus reality. The hype is Social Security is automatic. The reality is Social Security is a system. Systems don't care if you're tired. Systems don't care if you're busy. Systems don't care if you assumed everything was fine. Systems pay what they're told to pay based on the record they have and the instructions they receive. And your My Social Security account is where you get to see the instructions, which means if you never check it, you're basically agreeing to be the last person who finds out. So let's zoom out. Why do scams and mistakes cluster around this? Because Social Security is predictable. It's a monthly deposit, it's a known schedule, it's tied to a valuable identity. That makes it a magnet. And the uncomfortable trend is that the world is moving toward faster processing and more online management. That's efficient, but efficiency cuts both ways. It makes it easier for you to fix something fast. It also makes it easier for the wrong thing to happen fast. So the only advantage you have is attention, 10 minutes a month. That's it, a short scan for changes, errors, and strange activity. Not because you're expecting disaster, because you're refusing to be surprised by it. And here's the thought I want to leave you with. If your future retirement check is built on 35 years of reported earnings, and your current monthly check can be redirected with a few clicks, and your access to all of it depends on a login you might not test for a year, then the real question isn't, why should I check my Social Security account monthly? The real question is, why did we ever think we could afford not to?